Hi everyone, this is Lahiri from ABCs of Anesthesia, and one of my most requested topics was how to stabilize your cannula during insertion. Now this is a really important topic because a lot of the times you might be junior, you might be nervous, and you're doing a technique that might be a bit unfamiliar. So you really want to do all of these things to make yourself and your patient and your technical stuff really comfortable. And one of the first things you want to do is make sure that you're comfortable. For example, if I'm standing up, leaning over the patient like this, it can be very difficult on your back and as well on all of the things that make you stable to keep that stability. What I find is really useful is either kneeling down or being on a chair or a stool, and that way I'm comfortable, all of my body is comfortable, and then insertion is far easier. Now the height of your procedure is also a really interesting point. A lot of students will ask me, how high do I keep the patient's arm? Really you want to operate with your elbows lightly flexed at right angles with your arms parallel to the floor, and that's roughly the height you should be operating at. The angle of insertion is really crucial. So one of those things I always think about is, what are my body mechanics? How am I angling my body to insert this cannula? For example, as a right-handed person, if this arm is by the patient's side, that makes it quite difficult to insert the cannula because it's not really following my normal body mechanics. What I might do is have the patient's arm extended out and on an arm board to keep your arm stable, and then that follows my body's natural angles and mechanics far better. Now, if I'm a left-handed person, this makes a lot more sense to have the patient's arm near their body because again, that's more in line with my own body mechanics, whereas this feels really uncomfortable. Now, one of the most important things that I think about is having multiple points of fixation to increase the stability and to make up for any tremor that we have. What I mean by that is if I've got this cannula suspended in midair just with my hands holding it, it means that everyone has a tremor, and that tremor could cost you this vein, especially if the vein is tiny or you're trying to insert a really large cannula. So what I do is I have points of fixation. For example, my fingers, my little finger, my ring finger, I might just attach very gently to the patient's hand, and now everything's far more stable. This might also mean that I fixate my elbows as well. So I'll have my elbows fixated like this. That way everything is really stable. I'll have my arm resting on my knee or resting on the bed. It doesn't matter, as long as everything has a few points of fixation, it makes my structure far more stable.